Welcome on behalf of the MIT Department of Earth, Atmospheric and Planetary Sciences and the MIT Center for Global Change Science. My name is Anne Slynn. I'm the Executive Director of the Center for Global Change Science, and I'm very pleased to be a part of this event today. We have our Kendall lecturer for today is Francesca Dominici. She is the co-director of Harvard Davis Center Initiative and the Clarence James Gamble Professor of Biostatistics, Population and Data Science at the Harvard T.H. Chan School of Public Health. She'll be speaking to us about how much evidence do you need. In just a moment, I will pass the floor, the virtual microphone, to Professor Ronald Prinn, the director of the MIT Center for Global Change Science, to do a proper introduction to Professor Dominici. On screen, you should see the agenda. Just a note, Professor Dominici will be speaking for about 50 minutes. Following that, we'll have a question and answer discussion period, which I will moderate. During that webinar Q&A, I will be selecting questions from the audience, and you will be able to, at any time, enter your question in the Q&A panel of Zoom. In addition, we are going to invite you to raise your hand. You should have an icon at the bottom of your screen where you can do that virtually. And time allowing, we will be calling on a few people to verbally ask their question. You'll be invited to unmute and ask your question. That's just a little bit of housekeeping as we watch more people join in. Thank you again for joining us. And I'll pass it now to Professor Ronald Prinn, the director of the MIT Center for Global Change Science and professor of atmospheric science in the Department of Earth, Atmospheric and Planetary Sciences. Ron?
Thank you. Let me add my welcome to you all to the 18th Henry Kendall Lecture to be presented today, as Anne has already pointed out, by Professor Francesca Dominici. As Anne said, I'm the director of the MIT Center for Global Change Science, which co-sponsors this lecture together with the Department of Earth, Atmospheric and Planetary Sciences. And I'm also pleased to see today we have a very large international audience of alumni, friends, and benefactors of the department, the center, and the institute for this event. A little bit about the lecture itself, with its history. So the Henry W. Kendall Memorial Lecture Series honors the memory of Professor Kendall, 1926 to 1999. He was a 1990 Nobel laureate in physics, a longtime distinguished member of MIT's physics faculty, and an ardent environmentalist. The Kendall Lecture allows MIT faculty and students and the general public to be introduced to forefront areas in global change science by outstanding researchers. A founding member and past chair of the Union of Concerned Scientists, Henry Kendall played a leading role in organizing a number of very influential scientific community statements on global problems, including the World Scientists' Warning to Humanity in 1992 regarding the threat to the environment that was impending, and the call for action at the Kyoto Climate Summit in 1997. Today's lecturer, Francesca Dominici, is the Clarence James Gamble Professor of Biostatistics, Population and Data Science at the Harvard T.Y. Chan School of Public Health and the director of the Harvard Data Science Initiative. The scientific research addresses critical issues at the nexus of environmental science, climate change, and human health policy. Dr. Dominici has provided the scientific community and policymakers with comprehensive and compelling evidence on the adverse health effects of air pollution, noise pollution, and climate change. The studies are cited often in the national press and have directly impacted national policy on air quality. Francesca is a member of the National Academy of Medicine and the International Society of Mathematical Statistics. Last year, she was awarded the Carl E. Pierce Award for Outstanding Statistical Contributions for the Betterment of Society by the American Statistical Association. She is a strong advocate for the career advancement of women faculty. Her work on the Johns Hopkins University Committee on the Status of Women earned her the Campus Diversity Recognition Award in 2009. At the Harvard T.H. Chan School of Public Health, she had led the Committee for the Advancement of Women Faculty. Professor Dominici received a bachelor's degree in 1993 and a PhD in 1997, both in statistics from the University of Padua in Italy. And she is an honorary Master of Public Health from the T.Y. Chan School of Public Health in 2009. So it is my pleasure to welcome Francesca to MIT today. The full title of her talk is How Much Evidence Do You Need? Data Science to Inform Environmental Policy During the COVID-19 Pandemic. So Francesca, the stage is yours.
Thank you very much, Ron and your colleague, for the lovely introduction. I am honored and delighted to be here this afternoon to speak to you about how much evidence do we need and to talk about the work that I've been conducting with my colleagues on data science to inform environmental policy during the COVID-19 pandemic. These are some of the research questions that I hope to be able to address with you today and further discuss in our Q&A. Questions are related to whether or not the level of air pollution, even when are below the National Ambient Air Quality Standard, is safe to human health. We all know that the air quality is cleaner today than 10 years ago. The question is, are we doing the same type of progress into addressing environmental injustice? We'll talk about recent research on a relationship between chronic and long-term exposure to air pollution and COVID-19 mortality rate. And then I am a statistician, a data scientist at training. That is really my passion. And I would like to conclude telling you what, in my opinion, are the really important unresolved data science challenges that are connected to this work. So one thing I like to show this slide because because I am a data scientist at heart and a statistician, I love to see when policy changes are being informed, by data science. So we all know, and many of you are very familiar. On the left, you see that the level of air pollution in the air have been declining quite substantially over time in the last 20 years. And it's amazing how much progress we're made by cleaning the air. And that is really, we should really thank to the Clean Air Act, because the Clean Air Act actually revised all of the evidence about whether or not the level of air pollution, even below the National Ambient Air Quality Standard, is harmful to human health. And if the review of the evidence, and so that's where the data science comes in, shows that indeed the levels of air pollution below the National Ambient Air Quality Standard are harmful to human health, then by law, they have to lower the standard. So this has been really a policy where data science has been at the forefront. And I think that is a perfect example where when we use data and evidence to inform policy, we can get very excellent results. So the first scientific question is now, although we have cleaning up the air substantially, are the current national ambient air quality standard, which are currently for the long-term exposure to fine particulate matter set at 12 microgram per cubic meter, safe? And so that means if we are breathing levels of pollution below the safety standard, do we really see an increase in mortality risk? And then what are the vulnerability? Are peoples that are more susceptible to exposure to air pollution than others? So I do think that to do really important research in environmental policy and research even in the methodological advancement of data science, so whatever is standard statistical methods, sophisticated machine learning, artificial intelligence, the first thing we need is data, a lot of data, and data that to the degree as possible is accurate. So I've been spending a lot of my time, probably a big chunk of my career, to really thinking about how do we gather, harmonize, and link the best possible data on air pollution exposure and health and other variables and factors that can affect both exposure to air pollution and health outcome. We have been buying and harmonizing and linking claims data from the entire Medicare population. So it's over 97% of the population older than 65. We are following their health trajectory over time. So we know when they enter in the Medicare system, and then we know the date of every single hospitalization and the cause. And we also know their date of death. We know the zip code of residence. We know we know age, gender, and race, and we link to several information from the census data. So one building block of research, and to me, one necessary building block to do powerful, impactful data science is to build research data platform. And so really the goal is integrating and harmonizing a heterogeneous source of data and creating almost a research laboratory that is designed to learn how to prevent and treat disease. On one side, you have a national data platform that has information about environmental contaminant, the urban environment, risk factors, and then is linked to health. So that is really the a snapshot of basically the information that we have been purchasing, collecting, linking, harmonizing, cleaning, and curating on exposure to air pollution, health outcome, and confounders. Confounders are really important. These are variables like socioeconomic status or behavioral factor that might confound the relationship between air pollution and health. One challenge that we had is the fact that exposure to air pollution, although it's monitored well, is not monitored everywhere. So this shows the geographic location of the air quality monitored by the EPA, how they're measuring PM2.5. Daily level of PM2.5. So you can see the Environmental Protection Agency has been doing an excellent job in trying to measure daily level of air pollution, across the country. However, our health information, we have individual level health information for every single American older than 65 enrolled in Medicare. We know the zip code of residence. And so as you can see, there are areas in the United States where people live far from the monitors. So we wanted to estimate the exposure to air pollution, even if you live in more remote area, they are far away from one of the monitoring stations where potentially your exposure might be lower. And so this is really work that has been led by my colleague, Joel Joers, a professor at the Harvard THM School of Public Health. And he's been developing machine learning and artificial intelligence algorithm, which I'm sure many of you are actually doing similar work, where basically the idea is to take imperfect information on air pollution from satellite, so measure of aerosol optical depth, land use variable, weather variable, and other variable, training the algorithm through monitoring data and be able to estimate at the daily level for the last 20 years for every 1 kilometer grid in the United States, the daily level of PM2.5. So in this way, we could assign to every single person enrolled in the Medicare system their daily exposure to PM2.5. This is a fascinating area of research, and I'm sure that you actually at MIT and with experience in atmospheric chemistry might know even much more than I do on this topic. This is just a slide in the work that's led by a colleague Marianti, she's a faculty member at Columbia, where actually there are many different types of machine learning model and atmospheric chemistry model. They're trying to model and estimate daily level of fine particulate matter. One exciting area of research, I think, for everyone is think about ensemble learning and how you combine all of these models to get the best possible exposure and estimates of PM 2.5. So we now have a daily level of fine PM 2.5, and by the way, other pollutants as well, a 1 kilometer grid for all the continental United States, and we can link to the health experience of over 60 million Americans in the United States. We had a paper a few years ago in the New England Journal of Medicine, which was a really an important paper because for the first time, we were able to assess the health impact of air pollution, really not on a sample of the population, but almost on everyone, because it was 97% of the US population older than 65. We were really interested to assess as whether or not you have an increase in mortality risk associated with the long-term exposure of fine particulate matter below the national ambient air quality standard. So it's really important to look at this column here, sorry, at the last column, because we had over 32 million American and over 240 million observation that will allow to make inference as whether or not, even if you live in a part of the country where the level of fine particulate matter is below the safe level, you still see an increase in mortality risk. And we reported that indeed we do. So this picture shows that the horizontal line is the mortality increase associated with 10 units increase in fine particulate matter on average for the whole nation. And so we found that 10 units increase in fine particulate matter were associated with 7.3% increase in all-cause mortality on average for the whole nation. We started there to see some drastic environmental differences in risk across the socioeconomic and racial group. The Afro-American, the Black population had a mortality risk which was over 20%, so it was 3 times higher than the national average. We see higher mortality risk for fine particulate matter with the Asian and Hispanic population, also a little bit higher for people that were eligible for also the Medicaid program, which means a lower socioeconomic status. Now, when we had this paper in 2017, of course, had a lot of press attention, and as well as when you're trying to impact policy together with the press attention, there was also the criticism and the critical eye about the fact that in that statistical paper, in that paper, we use a pretty regular and standard, I would say, traditional regression approaches to adjust for confounding. So basically to adjust as other factors that might have impacted the relationship between air pollution and health. So one criticism was the fact that how do you really know that when you're reporting a mortality increase associated with PM 2.5, is really PM 2.5 the cause of the increase in mortality? And it's not lower socioeconomic status, it's not behavior, it's not obesity, it's something else, right? And so I think that what we did at that time, and we published the paper last summer, we rethought about the entire statistical analysis, developing new approaches and using existing approaches for causal inference. What is causal inference? Causal inference is an area of statistics, very prolific. There are hundreds and hundreds of excellent publications. The idea is the following: if you have an observational study and not a randomized study, how do you assess the causal impact of an intervention, of an exposure on health? And a way to do that, if you have a large data, is to consider the idea of matching. What's the idea of matching? Just figure for a moment that you have a woman, Jane, she's 50-year-old, she is a school teacher, and she is obese, and she lives in a high pollution area. What we're gonna do, we're gonna find all of the twin sisters of Jane that are the similar as possible as Jane, same occupation, same socioeconomic status, the same comorbidity history, but their twin sisters live in an area where there is not or less pollution. If we match Jane with her twin sister with respect to everything except air pollution, we can really disentangle the cause that PM 2.5 is really the cause of mortality compared to other factors. So there is a lot of statistical terminology and mathematical detail that I'm not going to be able to go into to be able to tell you today. But the idea is basically that we extended the data platform now to 2016 using even more data and estimate and assess causality. So what this plot shows on the left, it shows the percentage increase in mortality rate associated with 10 units increase in fine particulate matter when we use a traditional regression. The last three panels, these three, are improved estimates of the mortality risk when we use method for causal inference, where we're trying to be more rigorous about our ability to disentangle the main cause, PM 2.5, but other potential confounding factors. The most important panel is this one, because we also redid the estimation of concentrating for people that were exposed a fine particulate matter below the national ambient air quality standard. And then you see that actually the mortality risks are now much larger, and for causal inference method, they're around 25%. So this is saying that actually if you live in areas below the national ambient air quality standard, your mortality risk is actually even higher. So as you can see here, we found that lowering the air quality standard from 12 microgram per cubic meter as it is now to 10 microgram per cubic meter, we will save 143,000 lives in one decade. And that was a quantitative assessment that we can do because we're trying to really disentangle the main cause from other factors. Now, one thing that's really important on this work when you try to inform policy is to estimating the entire exposure response curve between exposure to air pollution and mortality, because you wanted to understand as whether or not there is a threshold, whether or not there is no relationship between a safety standard. This is work conducted by two former PhD students and now postdoctoral fellow and a faculty member. And so these are the exposure response curve for PM 2.5 when it's adjusted by all the potential confounding factor, including the other pollutants. You see that the national ambient air quality standard is around 12 microgram per cubic meter. And so you can see there is a linear exposure response function below 12. So there is definitely an increase in mortality risk, even when you are exposed at a level of fine particulate matter below 12 microgram per cubic meter. This is for the other pollutant for both air NO2 and ozone. You can see actually that doesn't seem to be a strong relationship with mortality for ozone at low level. But estimating in a very flexible manner exposure response function that have a causal interpretation, it's really important for environmental policy. I'll skip this slide. The second topic I want to talk about is the issue of environmental injustice. We all know from what has been happening in our country that Black Americans are suffering disproportionately, both from air pollution and from coronavirus deaths. What I want to talk to you about is a project, it is a work that has been led by AJ and our colleagues, where our goal is really to visualize racial income inequality in the United States. And through simply data visualization, we will gonna provide you evidence that actually this racial inequality in air pollution exposure are actually increasing over time. We are doing worse in terms of addressing this inequity. So I'm going to show you, I'm going to tell you two messages. One message is something that you are very familiar and not surprised at all. The second one, I don't know, but it really shocked me just again by visualizing that data. And so I will walk you through it. So the first message is the fact that air pollution has decreased drastically from 2000 to 2016 and is continually to decrease, has been decreasing by 43%. And again, thanks to the Clean Air Act, thanks to the work of many scientists around the world on providing evidence that level of air pollution below the National Ambient Air Quality Standard are still harmful to human health. So this is a map of PM 2.5 in the year 2000. Below is a map on the PM 2.5 in the year 2016. Orange are high level of pollution. And so on average, we are all breathing cleaner here. So now let me spend some time on these maps. This takes a little bit of time to walk you through it. And so I hope you're gonna follow me with patience and see whether or not you can, see the pattern that I'm gonna walk you through it. So first of all, only look at the map on your left side, okay? This map is the map for the year 2010, and I'm only showing the geographical area in the United States that are above, with PM 2.5, above 8 microgram per cubic meter. So these are the areas that have substantial level of PM 2.5. So in the year 2010, we have the area in California and half part of the United States, the east part of the United States, have average yearly level of PM 2.5 higher than 8 microgram per cubic meter. So these were the polluted area in 2010. The blue area are the area where there is a higher percentage of Black population. And that's also something you will recognize because we know that the Black Americans tend to live on the southern part of the United States. So these are the ones that have higher percentage of Black population. So in 2010, what we see is almost half of the country has exposure to PM 2.5 higher than 8. And among the area that have higher than 8, half of the country is where the Black population is concentrated and where the white population is concentrated, right? Okay, now let's turn your attention on 2016. In 2016, the first thing we see that we have a smaller number of geographical location with exposure to fine particulate matter higher than 8. Well, we know that. I told you that we are cleaning up the air, right? So the number of location they are pollutant is going to be lower. But the area they are continue to be higher than 8 microgram per cubic meter are mostly and predominantly the southern part of the United States and some area in California where underrepresented minority, in this particular case, Black population lives. So what you see here is that although the levels of air pollution on average is declining, it's not declining equally for everyone. It's declining much faster and favoring the white American and is not favoring equally the Black Americans. I was actually really upset when I saw this figure. And again, there is nothing mysterious. This is just data visualization. Now, we did more statistical analysis and we calculate the inequity. And so basically what this figure shows is the blue lines are the number of geographical location in the United States that are above 8 microgram per cubic meter. That's the blue, and above 10 microgram per cubic meter, and that's the green. And as I told you, we are cleaning up the air. So the number of the percentage of the population living in high polluted area, it's decreasing over time. However, we calculate the coefficient of variation and we're seeing that actually the amount of inequity, the variation of the percentage of population that are living in high polluted air is actually increasing because we are not cleaning the air equally for all of the racial groups. The third topic I want to talk to you about is about COVID. I'm sure that you all, and me included, are actually quite tired to even hear once again the word COVID. And so I apologize for that. But one very interesting research area and something that I started to think about as soon as the pandemic started was whether exposure to air pollution could exacerbate and make the response to COVID-19 worse. As you can see, when, last year when the pandemic started, we were already positioned to have all of the necessary data to assess exposure to air pollution, have a lot of information about the potential health impact, to be positioned to address this question. So with a former PhD student of mine and a faculty, who were a faculty member in the Department of Biostatistics, Rachel Nethery, they are the two co-lead authors of this work, we immediately got to work and tried to understand whether historical exposure to fine particulate matter could increase the mortality risk for COVID-19. We did a really, I would say simple, but comprehensive statistical analysis and reported the results of the study at the beginning of the pandemic. Now, why I started to think that COVID-19, why I started to think that PM 2.5 could make COVID-19 worse. A few years ago, to a colleague of mine, David Christian, is a professor at the School of Public Health and also a physician and pulmonologist. We together co-advised a PhD student where we found that long-term exposure to fine particulate matter increased the risk for acute respiratory distress syndrome. And as you might know, acute respiratory distress syndrome, which itself has a high risk of mortality, is one of the main causes of mortality for COVID-19. So as soon as COVID-19 started to emerge, and because of the work we did between air pollution and acute respiratory distress syndrome, I started to develop this hypothesis. Colleagues of mine have been actually identified and published the biological mechanism under which exposure to fine particulate matter can lead to acute respiratory distress syndrome and worse symptoms for COVID-19. The bottom line is that by living in geographical area, they have exposure to PM 2.5. It leads to an increased susceptibility. It can lead to a compromising your immune system. It will lead to go from mild symptoms to very heavy symptoms, like extreme symptom, because the higher viral load could lead to this could lead to this viral pneumonia. Then that could lead to enhanced lung damage and acute respiratory distress syndrome, and therefore death because of COVID. So there is, as I mentioned, there is a lot that we know about exposure to fine particulate matter. Particulate matter can penetrate very deep into the lung, can lead to, it can get in our blood system, and therefore could start a systemic inflammation. It could lead to cardiovascular disease. It can also compromise our immune system. So you can see that because of all of this information, because of the biological mechanism, we really wanted to address the question as whether long-term exposure to fine particulate matter not only provide and of course lead to all of these adverse health effects, but could really increase the mortality risk for COVID-19 after you have contracted the virus. So we published the first study on air pollution and COVID-19 back in November. And one of the major limitations of the study is that it's what we call an ecological regression analysis. So what it is that we were only able to regress county level information on historical exposure of PM 2.5 to county level mortality rate adjusted by all other confounders. And the reason why we did so is that unfortunately still now, we do not have a national health registry, medical record, a national registry on electronic medical record on COVID-19 patients. So until we don't have individual level information on COVID-19 patients, unfortunately, an ecological analysis is the only way that we can do it. Now, unfortunately, I think in some geographical area now, we start getting access to individual level record. And now there are data from the VA, that the Veteran Administration that has individual level record. And so the link between air pollution and COVID-19 actually since last fall has been studied with many, many additional studies that actually have even more, a much better rigorous framework than what we did here. The idea is basically is that we looked at whether county level exposure to fine particulate matter were associated with the county level mortality rate in COVID-19 and accounting for many different potential confounding factors, from access to health care and the number of hospital beds, from population density, the age, the demographics, socioeconomic status, and many more. By the way, all of the data and the code for this paper are publicly available on the website associated with the publication. Well, what we found, and that was at the time of still under the Trump administration, at the time where the Trump administration has recommended not to lower the national ambient air quality standards, so it created a little bit of an uproar in Washington, D.C., is that what we found is that if you take two hypothetical counties, they're similar as possible with respect to socioeconomic status, population density, stage of the pandemic, smoking rate, whatever we could adjust for. The county that have higher level of fine particulate matter, historical level of fine particulate matter by only 1 microgram per cubic meter, have a 11% increase in mortality risk for COVID-19. This plot shows the estimates of the mortality rate ratio ranging between 8% up to 11% as more deaths from COVID-19 were accumulating over time. So it's really strong evidence that historical exposure to PM 2.5 increase the risk of COVID-19 mortality. Now, fortunately, I would say this is not the only study. Since we came up and it was reported on the New York Times, we are now reviewing and counting almost more than 60 peer-reviewed publications around the world. They are linking short and long-term exposure to air pollution with the COVID-19 incidence and mortality. I think that what's really important for us to also try to understand the clinical, environmental, and racial the determinant of COVID-19 mortality. And with a colleague of mine, a faculty member in the School of Medicine, we actually wrote a commentary and tried to connect the dots between COVID-19, air pollution, and racial inequity. We also found, not surprising and very, very unfortunate, that a county that have only 1 standard deviation increase in the percentage of Black residents have up to a 49% higher increase in COVID-19 mortality. Unfortunately, we all know and have experiences that exposure to air pollution has made COVID-19 mortality even worse for Afro-American and Black population. The other really important element of research in the context of atmospheric change, climate change, air pollution, and COVID was an international collaboration where what we wanted to do is to estimate the regional and global contribution of air pollution to the risk of death for COVID-19. Led by colleagues really from all around the world. We found, for example, that in Europe, with a population of 628 million, we have that the COVID mortality fraction attributable to fossil fuel-related emission was around 13%. Of course, there are very wide confidence interval, and North American is 14%. With respect to the COVID mortality fraction attributable to the all anthropogenic emission, we have 19% in Europe, we have 27% in East Asia, and 17% in North America. So that's, my hope is that, unfortunately, we have all been devastated by this pandemic, could provide an additional source of evidence of the importance of controlling fossil fuel related emission. Some very recent work that we have just concluded was co-led by a current postdoctoral fellow Kevin Josie and Jordan Zhu, which is a data scientist at Esri, and tried to link the relationship between very high level of fine particulate matter during the devastating wildfires that have occurred in California in 2020 and COVID-19. So the question here that we try to address is, did the high level of PM2.5 emitted from wildfire exacerbate the number of COVID-19 cases and deaths? So all of these also, this data is linked and also publicly available. So we took data from March to December, which was the devastating wildfire season on the west part of the United States. This plot shows the blue dots are the level of fine particulate matter, and the orange are the days where the wildfires have occurred. And so you can see that during the wildfires days, the level of fine particulate matter spiked really, really high. This is for Los Angeles County. The red dots are the level, are the daily number of COVID-19 cases, and the black dots are the daily level of COVID-19 deaths. So what we wanted to do is, for each of the 92 counties in the western part of the United States that were affected by wildfires, did we have the spike, the high level of PM2.5 have exacerbated, have increased, and the number of COVID-19 deaths and the of cases compare if, with respect to what would have happened if wildfire did not occur. So we started with what we call the counterfactual time series analysis. So let me tell you what this plot shows. I thought it's very interesting. So this is the data for Los Angeles County during the wildfire season last year. The blue dots are the level of fine particulate matter in Los Angeles County in 2020. These gray lines shows the days that, based on satellite data, we know there was a wildfire day, right? So you see that in the beginning of July, this day we had a wildfire day, and the level of fine particulate matter was 60 microgram per cubic meter, right? So you see that on the wildfires days, these are also this orange line, the level of fine particulate matter tends to be pretty high. The black lines shows the average level of fine particulate matter for the same day, for the same geographical location, but in the previous year, 2016, 2019, excluding the days that could have wildfires. So this will be basically the expected level of fine particulate matter that we would have expected to see in 2020, absent the wildfire. So we could calculate the extra level of fine particulate matter that occurred because of the wildfires. What we found is really interesting. First of all, even without considering wildfires for a moment, a 10-unit increase in fine particulate matter lead to a percentage increase in COVID-19 cases on the same day, on the day after, and could lead to a percentage increase in COVID-19 cases up to three weeks after. Actually, we conducted analysis after 1 month after, and there is actually an increase up to a month. Similarly for COVID-19 deaths. So this is saying that a 10 units increase in fine particulate matter on this particular day could lead up to a 1 or 2% increase in COVID-19 deaths up to 20 days later. We estimated the percentage of the total number of COVID-19 cases that were attributable to high level of fine particulate matter on the wildfire days for the 3 states that were affected. The gray counties are the ones that were excluded from the analysis because we didn't have adequate data. And we found that for some geographical region, we could have a smaller percentage increase, a smaller percentage of the total number of COVID cases. So it could be as low as 1 or 2%. But in some counties of California, for example, in this county of California, we have that of the total number of COVID-19 cases, 15% were attributable and therefore could be prevented if we didn't have wildfires. Similarly, we also did the same estimation for the deaths, and we found actually that the percentage of total COVID-19 deaths that were attributable to high level of fine particulate matter on wildfire days was even higher, and it ranged between 10% to as high as 50%. So I wanted to have the last topic of the talk to tell you about how, when we do all of these studies and we make very important policy decision, there are an enormous amount of data science challenges that we have to overcome. I think the biggest issues is that everything we do in environmental science, as you know very well, it cannot be controlled under randomized experiment. Ideally, we would like to be in a control setting where we randomize a group of people to be breathing a cleaner air and another group of people to breathe higher pollution air. Of course, that's not possible. So we are all dealing with observational data where we never have a control group. We have what I often call an out of control group. So there are many, many, many challenges and things that we are working on it, and could lead to a lot of many PhD theses and additional issues that I think are really important to think about, especially when these results are informing policy. First of all is the issue of uncertainty quantification and propagation, especially in the context of machine learning. And I'll tell you a little bit more about what I mean. There is the issue of causality. So yes, we are using better approaches and developing better approaches to make sure that PM 2.5 and exposure to an environmental contaminant is the cause of the mortality, but that's not easy to assess. And so I gave you some sense of how we're going to deal with a measure confounding. If some of the confounders are not measured, then our ability to assess causality is highly compromised. And then there is the issue of reproducibility and replicability of scientific findings in the context of massive amount of heterogeneous data. It's easy to say the data and everything should be reproducible, but it's really hard when you're trying to harmonize and analyze a data platform that could include over 700 million observations. So in terms of the uncertainty quantification, and I mentioned here my colleague, Marianti, we all call her Marianti because her last name is too long to be pronounced. Marianti is a faculty member at Columbia in the School of Public Health. And she's been really working with us to try to understand and how to quantify and propagate the uncertainty in the assessment of exposure to air pollution into our health effect analysis, especially when the exposure of air pollution is estimated using ensemble learning or a combination of machine learning models. For example, both data science model, but also atmospheric chemistry model. To give you an example, on the left is the level of fine particulate matter in the Boston metropolitan area. You can see that closer to the urban area in Boston, the level can be as high as 10, and then when you go more in the rural area, can lower to 6. This map here is an assessment of the uncertainty that we have about this level of air pollution. So around Boston, where the air pollution is monitored very well, we have a wide areas because we're pretty certain, pretty precise on our ability to assess exposure to air pollution. But in areas that are far away, in the purple area, we are more uncertain. So how do we quantify this uncertainty, especially when we are estimating the exposure to air pollution using combining machine learning methods, and how then we propagate this uncertainty into the health effect estimation with massive data set? I told you a little bit about assessing causality. Assessing causality in air pollution research and environmental research, and more generally in observational data, it's really hard and they require a lot of thinking, required to figure out what are the exact assumptions, whether or not we're violating assumptions. So for example, what are the exposure level are being compared? What is the causal effect that we are interested? What is the counterfactual? So what is the potential outcome? What would have been the health outcome if we would have reduced the level of air pollution, or if we would have impacted that policy? And what is an adequate control group, and so on. So to just give you an example once more of the idea of matching, because I do think it's a very powerful idea in causal inference that has been talked about and published for a very long time. It's the following. So again, if you think about Jane, lives in Steubenville, Ohio. Jane has a low educational status. And because she lives in Steubenville, Ohio, she's breathing high pollution level of PM 2.5. To understand what will be the causal effect of PM 2.5 on Jane, and I'm sorry, on Jane also, we know that unfortunately, she died at 72 years old, right? So we know the history of Jane. Jane is a low socioeconomic status. So Jane lives in an area with high pollution level, and we know the age of death for Jane. Now, what we wanted to do now is to estimate what would have been the age of death for Jane if Jane herself would have been transplanted to Portage, Wisconsin, where she would have breathed a low level of air pollution. And so the way that we do that, we go on a location where there is low level of air pollution. We found the control group. Which is the control group? The control group are all the twin sister of Jane, the same women, the same socioeconomic status, the same comorbidity, but they have been breathing lower level of air pollution. If the average time of death for this group, let's say, is 65, well, we will say that higher level of air pollution would have caused a reduction in the number of years lived from 72 to 65. So that's really the fundamental idea of causal inference. There is a tremendous amount of work, and this is a very, very excited area of research at the intersection of data science and computer science and environmental policy. And so I'm really happy to just show you here some of the work that we are doing with my colleague, and really thinking about machine learning to identify vulnerability in high-dimensional data, machine learning to understand health impact of air pollution impact on an outcome that could be very high dimensional, including some of the work that some of you are interested into evaluation of the health impact of particular policy intervention. So it's, as I mentioned, the reproducible workflow is absolutely necessary. And so through my colleague, the data scientists, Ben Sabat and Naeem, who is a software engineer, we're really doing the best that we can in developing this data platform about everything where the workflow for our research is reproducible. It's really hard work, and it's not really, I have to confess, it's required a tremendous amount of time, resources, and intellectual contribution as well. So I wanted to conclude by saying that by no means this is all my work. I am privileged to interact on a daily basis with a phenomenal group of scientists and students. We have, I will call it, created a consortium, which is called the National Studies on Air Pollution Health. Leila and Nisha have been the two program managers of the consortium. We have principal investigator from many other institutions that are providing leadership and ideas, and in leading many of these projects. There are 15 postdoctoral fellows, several PhD students, master student, and undergraduate student. And so I just want to take some time to show you them all and how grateful I have to learn from them every day. That's are the members of some of the faculty members from Boston University, Columbia, Yale, and Harvard Medical School. And so these are some of our student postdoctoral fellows, master student, and more. And so I wanted to acknowledge them all because, as you can see, there is a lot of work behind the scene and phenomenal work that is leading to really PhD thesis and senior thesis that I am very proud. So I'm gonna end with, these are also part of my support group. This is Dory and Tilly, my two Black Labradors. And one is 1 year old and the other one is 3 years old, that provide I would say, inspiration and emotional support for most of the work that we do. Thank you very much for your attention.
Thank you, Francesca, very much. Thank you for sharing such great information. It's a fabulous body of work that you've undertaken, really impressive. I'm still trying to process some of it. And thank you also for sharing your dogs. That's a wonderful ending there. We have quite a few very interesting questions, probably more than we will be able to get to. So we're trying to select. There are a few, and I want to mention again, there are a few people I've interacted with. I would, at time allowing, invite them to actually speak their questions to you, because I think it's a little more engaging than me trying to reread things in the chat. So I'll just do a shout out to those who have put questions in. If you would like to be called upon to actually ask your question verbally, please raise your hand if you can find the icon on your window, so I will know that you would like to speak. Oh, and one popped up there. So we have a question, actually maybe more than one, from John Bachman. I hope I'm pronouncing it properly. And I'll, if our AV David has it under control, we'll just invite John to speak. There he is, go ahead.
Fine, thanks. Hi, Francesca. I just once again want to congratulate you on the largest, most sophisticated, and likely most significant work ever done to date on the effects of fine particles. That latest piece of work, it was great to see it and learn more about it. My question really goes back to D et al. 2017. The ozone map, you didn't show it, but if you look at the, you found a significant effect of ozones there, even though you didn't in the most recent study, but as you know, ozone levels didn't go down much in the United States between 2010 and 2016. So that doesn't say one thing or another, but nonetheless, your other study suggests a very different pattern of where ozone is causing health effects than the map of the United States that violates the standard. That means the Eastern United States, Northeast especially, has a problem. Your map doesn't look like that at all because you used a different averaging time. You used the seasonal averaging time. Do you have a sense that maybe we've got either the wrong or not enough indicators in terms of averaging time for the ozone standard based on that?
So thank you, John. And of course, you know much more than I do about all of this. I've been working at the Environmental Protection Agency in a leadership role, I don't know for how many years. So I'm not sure, though, I follow your question, because I did not show any map of ozone. So I showed maps for fine particulate matter, but I didn't show a map for ozone.
I'm sorry, you didn't show it today. I'm simply saying that the D study that you referenced, you did show the PM map, had an ozone map in it, and the ozone map suggested a much more western, west of Midwestern area of the worst effects and exposures. And in fact, a map of the current ozone standards suggest an Eastern orientation that looks quite different. So now my question is, have you thought about that implication?
Okay, thank you for clarifying. Well, the quick answer to your question, I don't know why our map back in 2017 for the ozone looks different from what the EPA is reporting. So I think that what you're saying is really important for us to find out what are the discrepancy about the spatial variability of ozone that we reported in the paper versus what the US EPA is reporting. In the paper back in the New England Journal of Medicine 2017, we report the average ozone for the entire period from 20 to 2016. So I think we need to look at what is the average period that was reported in the US EPA. Estimating the health effect of ozone and whether or not there is a adverse health effect of ozone, a level below the National Ambient Air Quality Standard. By the way, there are no standards, you know better than me, for ozone. It's a much more challenging, challenging task. So what I can tell you is that every analysis we have been doing, it shows that the evidence tends to be very weak and sometimes inconsistent. And that's why rigorous estimation of the causal exposure response function, I showed the causal response function for ozone, It's so important because we need to disentangle the effect of ozone from heat and sun exposure and other factors. So I think I really appreciate, you pointing that out. I will get back to you about the inconsistency, but the assessing causality of long-term exposure to ozone on mortality is something that we are looking very, very carefully right now.
Good. Thank you.
Wonderful. Thank you for that interaction. I have quite a few other questions that I'd really like those questioners to ask verbally, but I don't see anyone else raising their hand that they are willing to be unmuted. So I'll read one until, oh, no, there we go. Susan Solomon has agreed. She jumped in. Dave, if you could get her there, very good. Go ahead, Susan.
Hello, thank you for a lovely talk. I'm just curious, it was very impressive that the differences in 2.5 between minority populations and the rest of the United States, but I know that air pollution decreased overall, and you talked about that as well during COVID. Did it decrease as much in the minority communities as it did in the non-minority communities? Is there enough information to say anything about that? I mean, nevertheless, they had more COVID, which doesn't surprise me either, but I'm just curious whether at least they had some relief of COVID.
Yeah. So excellent question. And I think the intersection between PM 2.5 and temporal changes in PM 2.5 and the impact on environmental justice it's a really fascinating and complex question. So let me try to unpack it a little bit. So first of all, if we take for a moment COVID aside, let's try not to think about COVID for a moment. What we have found and what it shows is that even though PM 2.5 have been declining over time, have been not declining at the same rate across the different socioeconomic and racial group. So have been declining much faster for the people that have higher socioeconomic status and are white than lower socioeconomic status and Black. I didn't show this plot, but that was something that made me really think about it, that if you look at the level of fine particulate matter over time, throughout the entire period, even though the PM 2.5 is declining, the level of fine particulate matter for the Black population at the highest socioeconomic status is higher than the white population of the lower socioeconomic status. So underrepresented minority Black American have been exposed to fine particulate matter, always a higher level throughout the entire period, and the level of fine particulate matter has been decreasing more rapidly for people that are better off than others. Now, there is the other question about the health impact. And so the results that we have found, and we're digging deeper on these results, is that for the same increment, for the same increase in fine particulate matter, we see that the mortality risk for the Afro-American population is much higher than for the general population. Now, for COVID, we will not be able to disentangle whether or not the effect of air pollution on COVID was higher or lower for the Afro-American population, although you can imagine that would be the case because we didn't have race in the information about COVID-19 deaths. But we do know for sure that both Afro-American population have been exposed to a higher level of PM 2.5, and then we also know the Afro-American population had a higher mortality rate for COVID-19. Now, there might be a lot of underlying factors at play, really the type of occupation, the living condition, the co-exposure. So there are a lot of, I think the pandemic has provided a new lens to really try to study the issues of environmental racism that myself and many of the colleagues are really looking into.
Thank you for that, Francesca. Well, I am going to go for a question that's in the chat now, but it intrigues me. How can we explain lack of such overwhelming COVID deaths in New Delhi in India, of course, where the air pollution has been very severe and sustained. Do you have any insights in moderating variables?
Yeah, I don't have the answer for that. I think that there is a lot that we don't know about COVID and how it's developing, and what are the many other concomitant factors. So I think that this is why I hope that what has been happening all around the world with the pandemic will provide will provide more attention to public health research and data science. And so that's something that we'll need to find out. But to be honest with you, I don't know. And there might be many different reasons. And we know that the type of situation in India, and also, we need to figure out by India, I mean, India is pretty huge, and what's happening right now, and the role of other concomitant factors, how the data are reported, how the data are standardized. So there are many other factors which, unfortunately, I wish I knew the answer, but I don't know.
Okay. We don't know, right? There's so much we don't know. And the more data you get, the more confusing some of it is. I was really taken by your slide on assessing causality, because that just, to me, seems like the biggest thing. There's just so much going on at the same time. I'll take one more question from the chat and then maybe turn to Ron Prin, I know who had his hand up there. So first, from Bob McClatchy, much of your work is dependent on the density of PM 2.5. I would think that the health effects might also be dependent on the chemical composition of the particles. Have you examined this role, or the role this plays as well?
Yeah, excellent question. I couldn't agree more with you. So yes and no. So before, I would say up to 5 years ago, there's been a lot of work on examining the role of and the health impact of the PM chemical components on health outcome. I've done research myself and many of other colleagues. We haven't been able to, that's my understanding, to pinpoint and provide a compelling story of whether one component of fine particulate matter is more harmful than the other. And I know that's really important, because then we can try to trace it back to emission sources. And I think that one of the reasons is that even though the EPA is monitoring PM 2.5 chemical composition, I don't think that the measurements are accurate enough to be able to, to really disentangle the effect of one component to another. And also might be that even if they're measured enough, we don't have the statistical tool to do the right job. Now, having said so, I think now with the pace of research on understanding exposure to chemical components, and many of my colleagues that are listened to here, they're very expert on the topic, is accelerating very fast. And so I am actually re-energized about that question, because I do think that with our technological advances, with satellite data, with better atmospheric chemistry model, with better machine learning model, I do think that there is now and a really great opportunity to assess exposure to chemical component in a much more rigorous manner. So I think, the bottom line is, I tried to do the work a few years ago. I was a little bit discouraged that I couldn't come up with something that could impact policy. I paused for a little bit, and now I see there is a new energy in the scientific community of improving exposure assessment to chemical components. And so therefore we are teaming up with several leaders in the field to try to address that question, because I do agree with you, it's really very important.
Thank you. Ron, maybe I'll invite you to unmute yourself. Do you have a question?
Yes, thank you, Francesca, for a wonderful talk. My question pertains to the problem of finding a true control for you to use. And you have this analogy of the twins of Jane. So you've got a Jane in a very polluted area, and you're looking for twins in non-polluted, very non-polluted areas. At the same time, you showed that map of where the US measurement system has very big gaps in regions, of course, where air pollution is suspected to be or scientifically proven to be very low levels of pollution. Would it be helpful if you were given more observations in these so-called less polluted regions to get that better control for your numerical experiments?
Yeah, no, absolutely. I think, Ron, you have identified the biggest challenge that we have with all of this research. And so having a couple of things, I mean, there are two major challenges. One is that it would be wonderful to have a more monitoring station in areas that, that are potentially have low exposure, because clearly more observation we have from monitors, more accurate are our machine learning approach for estimating the exposure. And then I think that the selection of the adequate control group and the way that we can select that appropriately and match with respect to everything that could be associated with exposure of our pollution is another challenges. And I think that's why I think, though, I'm optimistic, because with technology, we're getting more better, accurate measurements. And I think that with more data, we can select our control group, like the example I was giving with Jane and a twin sister, by matching by more and more and more information. And so more information we have available to find the exact twin sister of Jane, more confident we are about our causal conclusion. And that's why, to me, the building of research data platform that I think in our field sometimes was a task that sometimes is seen as infrastructure or not important, it becomes of paramount importance when you try to assess causality, because the better data, more information you have, better is your ability to select an adequate control group that is the same as possible of the person of interest, except the exposure, and then quantify the exposure as accurate as possible with more measurement possible.
Thank you.
Yes, thank you. I want to move on to a slightly different topic. We had several questions on this, and I find it very fascinating and a little touchy, I guess, in a way, the racial inequality issue. So why do you think we see this? What is the source of the PM in the Southeast that hasn't been controlled as well? You've obviously given this a lot of thought. Where's that going?
Yes, so first of all, let me say that, so that work started really with the collaboration with Cory Booker and his team. And so just to tell you what has been our process and thinking about this issue, and by no means I'm going to give you an answer. So when Senator Booker looked at our paper in the New England Journal of Medicine, and where we reported the mortality risk for Afro-American associated with air pollution, which was 3 times higher than the level on average, of course he was, as he should be, very upset and very concerned about it. And so his team contacted me during the COVID-19 pandemic as we were visualizing data on racial inequality. And actually that visualization came from having multiple conversations with his team, because they wanted to understand where the problem and why is the problem. So we have identified now, I think we have now characterized the problem, which has been paramount for them to develop a bill to control and implement more stringent regulation in the most vulnerable area, which is in the one in the South. And so the goal of that work was really to provide the data visualization to show, just showing the data that, the area that are still pollutant in the United States as today are predominantly the area with the larger percentage of Afro-American population. So we kind of characterize the status quo. Now, you're asking a critical important question, which is the why, right? So the hypothesis, we don't know the why, but the hypothesis and what has been discussed and what we are researching is that there is a little bit of a structural problem in how the National Ambient Air Quality Standard are, what are the rules to comply to the National Ambient Air Quality Standard, in terms that, you know, let's say that we lower the National Ambient Air Quality Standard from 12 to 10 microgram per cubic meter, and then the states are asked to have their own state implementation plan and to figure out how to meet the standard. But we are not actually looking with more rigor the vulnerable community. So the hypothesis, and again, this is an hypothesis, it's not scientific findings, is that as there is a pressure to regulate more, there is a pressure to try to pollute in area that have the less ability to fight against. So the classical example is, you know, in very wealthy area, you know, if you try to implement a new power plant, even if they say that it's compliant, well, there is immediately going to be a lawsuit by, you know, my geographical area, by 12 Harvard Law School, Harvard lawyers, so they're not going to allow it. But in this remote area, on the vulnerable area, there is really less pressure to defend themselves. That's one hypothesis. So there is a less ability to fight against. The other hypothesis is that it's possible that there are multiple sources of fine particulate matter in this area that is more harder to control simultaneously. So the path that we're taking, and this is highly controversial, is very tentative, but it starts to thinking about whether area where the population is more vulnerable, whether or not the levels and the requirements should be even more stringent. Because simply from a data perspective, if you wanted to simultaneously clean the air for everyone and at the same time eliminating disparities, we should implement more aggressive regulation in the most vulnerable area than in the other. So again, this is really, I think, another important area of research. And, you know, I was discussing with Noel Selin, a faculty member at MIT before, as whether we can really strategize on what type of policy regulation not only achieve the fact of lowering their pollution on average for the entire nation, but also address inequities. And this is really something that we haven't been thinking about, I think, and this is something that the current administration is really focused on. So thank you for raising this issue.
And thank you for answering it so articulately. It's spurred us to think of other questions that are related. And I wonder, could we do a follow-up? Not to beat it to death, but there's more here because the rural and urban differences seem to be key. Does the disparity exist in both, and or are the differences worse in more densely populated areas?
Yeah, great question. So we have conducted exactly the same analysis to see whether the increase in environmental injustice was only predominant in urban area or was only predominant in rural area. And the increase in environmental disparity and environmental injustice is going exactly in the same direction, whether you're looking only rural area or whether you're looking only urban area. So it's a phenomenon that doesn't depend on the degree of urbanicity.
Great, thank you. At this time, I'd like to invite another, someone who's raised his hand. Is Doug Worsnop? I apologize if I've mangled your name. But he has a question he hasn't told us, but I'm pretty sure we know who he is, a local chemist. So go ahead, Doug, if you're online there.
Yes, this is Doug Worsnop. I have a comment and a question on the PM chemistry issue that you discussed a little bit earlier. This was a great talk, but for me, what it did, among other things, is it confirmed that the relationship between mortality data and PM 2.5 math is the strongest and more robust environmental pollution correlation we've ever had. and it's true all over the world. And you showed it again really well. Now, it is the glory of the EPA that we have these PM 2.5 measurements everywhere, and they're even standardized. But I'm one of those aerosol scientists who has believed for decades we need to figure out which chemistry is the most important, the most toxic. And we have tried, okay? There's all kinds of laboratory studies, and we're getting more and more chemistry measurements. They're not as good as the general PM 2.5 measurements. But nobody can find a correlation so far, and it isn't because people haven't tried. You said it again in your answer. You're the data scientist. Is the data just not good enough? Or is the reality that for reasons we still don't entirely understand, PM 2.5 is the representative measure of this problem or this effect? I mean, I'm beginning to believe we tried so hard to uncouple the PM 2.5, but with the data so far, as I understand it, just isn't there. So, thank you.
Well, I mean, you couldn't have elaborated the biggest challenge we have on environmental research of this decade and maybe forever. So I couldn't agree more with you. I mean, it's right on. So now, so let me share with you my thoughts. So first of all, so Doug, I couldn't agree more with you. And I wish that first we will have the best possible measurement, and maybe we'll get there. And then if we have the best possible measurement, I feel that actually the data science tool is actually there. So I think that if there is a problem right now, I do feel that is the problem with the measurements. But putting the problem aside for a moment, which is the largest and most important question, what I would like to argue with you is, do you think that, so right now, the current administration are saying that we should not lower the national ambient air quality standard for PM 2.5. So even if PM 2.5 is a, it's just a marker and it's the total mass and doesn't allow you to of course, disentangle the fatal chemical component, I do believe that as for today, providing the most compelling evidence that fine particulate matter total mass is harmful to the point they're going to change their decision and lower the national ambient air quality standard from PM 2.5, that is really important because, as you also pointed out, we have national, international evidence that PM 2.5 is bad for you. So I do think that showing, and again, it's not easy because even though on one hand say, well, we all know, but even if we all know, the current decision is not to lower the national ambient air quality standard for PM 2.5. So I do think that rigorous, continue to be rigorous research of what we all know to be able to lower the PM 2.5 is really important. I think what you're getting to is both from an atmosphere, from a chemistry viewpoint, but also from a policy viewpoint, because I do think, and I completely agree with you, that there is a point where we will not be able to lower PM 2.5 anymore because we don't know what to do about it. And so understanding the chemical component and understanding the sources, it's important. So, I mean, yes, I agree with you. I do think that my gut feeling is that is the problem with the measurements and not with the ability to disentangle. But on the other, because I think that if we were have the best, if we had the, and other people might have a different opinion, of course, but if we were have to have a very precise and spatial temporal resolution, the information about the components, I do think that we have with the national data that now, scientists have, I do think that we will be able to do the, pretty good job on separating the effect of one component from another. Again, never is going to be perfect, never going to be perfect, but I do think we will get closer to finding something more consistent that we have been able to find. But I'm also a very optimistic data scientist, so I might be completely wrong about that. But thank you. That's a very thought-provoking question.
A quick response. Anybody who knows me knows that I am not a policy person. I'm just trying to understand the correlation. Look, I would love to talk more because I think we know enough to, through modeling or whatever simulation, to in the US, estimate chemistry as a function of geography. We don't have all the measurements, but we know enough. And that's really my question. We've really learned a lot in the last 20 years.
Thank you, Doug, for your comment. We do appreciate the interaction. We just have a few more minutes here. So I wanted to get to one last question, and I'm kind of merge together a few and just let you speak about it in general, because it's more on the issue of communication. And it's communication to policymakers, to the public, to the deniers. A lot of people come back to this. Do you have advice or strategies to convince a science doubter, I shouldn't use the word denier, that despite uncertainties, the preponderance of evidence suggests environmental harm exists from an anthropogenic pollution? I'll give you one more. He just went on to say, your talk focused on the adverse human health effects from breathing pollution. Climate change science shares a similar hurdle in convincing policymakers and some in the public that they must act to mitigate. Do you have some parting words for us there to give us some hope?
Yeah, thank you. I'm just writing myself a few notes because, this is an important question. It's something that is really in my heart. And I agree with you. I mean, I have not been able to talk about it today, but the health impact of climate change is perfectly related about a lot of the work that I presented. So in terms of communication, and I have to say I've been thinking of that. I've been thinking a lot because I found myself in the middle of a war during the COVID-19 pandemic under the Trump administration, and how do you move forward the science? And so I was thinking 3 points that I have learned and I've been compliant to. So one is stick to the science and stick to the data. And I do believe that the peer review system and the important data and the important scientific findings, I think it's really the most important element for the long term to impact policy and to convince the denier, the people that are skeptic. So the first point is stick to the science and stick to the data. The second is resiliency, because I do think that in this area of research, it's important to be resilient and not to take criticism personally, but again, to always aim to the highest possible scientific rigor and integrity. And so even though there have been many occasions, for example, where I thought, why I'm doing this research, why I cannot work on something less controversial, no one is gonna bother me. So being resilient and, take the punch, but then get back, I think it's really important. And finally, I think what for me keep me going and what is important for the long term for communication is the training of the future generation, and to basically practice by example and teach them that sticking to the science and rigor integrity ultimately. And I think we're seeing that, especially this, with the latest things that are happening this week with the new administration, that pays off. I think that, investing in the new generation and in training where you are being able to the best possible of your ability to communicate the science with uncertainty and at the same time try to be as rigorous, as well as being able to say, I don't know, I do think can be a very effective way to communicate and lead to the desired impact in presence of people that are skeptic or offering alternative explanation, which I do think in science always will be there, and especially I think, you know, when science intersect with the really important policy decision.
Thank you so much for that, Francesca. Very level-headed, expert advice, inspiring as well. And it leaves us on an upbeat note, even though much of what you presented is a little bit depressing, you know, so it's a great mix. Thanks for the roller coaster today. So I have to apologize to the people who asked questions that we didn't have time for. We have come to the end of our evening, our afternoon here, and I just want to extend a great thanks. Maybe Ron also wants to insert his in just a moment, but in a moment I'll show a slide where people could potentially get a hold of you again if they had follow-up questions. There will be a website there that will provide her contact info. So on behalf of everybody, and thank you for joining us. Thank you to the speaker. Ron, is there a word you'd like to say?
Well, I was just going to clap.
Very good, very good.
Thank
So
you.
I'll do that.
Thank
Yes.
you very much.
It's been wonderful to have you with us, Francesca. Thank you so much for agreeing to this. Thank you everyone for joining us. And that's the end of our event for today, but we'll leave
Thank
this
you.
information online.
Great. Thank you very much. Bye-bye.
Bye-bye.